Hello, and thank you for taking the time to view our presentation for the annual Michigan Summit on Quality Improvement and Patient Safety. Our quality improvement project, entitled A Modified Stop-Bang Screening Tool in the Primary Care Setting, was composed by contributing members Drs. Joshua Wan, William Palmer, Omar Khan, Faye DeBaha, Saad Khan, David Gessert, and Maria Tovar Torres, in association with the Department of Sleep Disorders at Henry Ford Hospital in Detroit, Michigan. As an introduction to the purpose of our project, obstructive sleep apnea, or OSA, is a condition associated with multiple cardiovascular comorbidities and increases perioperative risk for surgical patients. OSA is prevalent in 17% of men and 9% of women in the age range of 50 to 70. 80% of men and 93% of women with OSA are undiagnosed. For our project, we want to develop a convenient, abbreviated screening tool for OSA in the primary care clinic that will flag patients in the electronic medical record who are at risk for OSA. With this screening tool, our goal is to reduce the number of undiagnosed patients with OSA by increasing the number of sleep studies performed by 50% over the next year. For our quality improvement project, we are utilizing the Plan, Do, Study, Act model. Our plan involves using elements of a validated screening tool for OSA known as the Stop-Bang questionnaire. The questionnaire consists of a series of 8 yes or no questions, including: does the patient snore? Do they have a history of tiredness, fatigue, or daytime sleepiness? Have they ever been observed to stop breathing during sleep? Do they have or are they being treated for high blood pressure? Is their body mass index greater than 35 kilograms per meter squared? Is their age greater than 50 years? Is their neck circumference greater than 16 inches or 40 centimeters? And are they male? A score of 3 or greater on this questionnaire indicates a high risk of OSA. From the Stop-Bang questionnaire, we will use 3 objective criteria as our screening tool. These are a diagnosis of hypertension, a BMI greater than 35 kilograms per meter squared, and an age greater than 50 years. And how will we validate our screening tool is effective? We started with a retrospective population-based cohort study. For our project, we looked at patients in the Henry Ford Academic Internal Medicine Clinic from January 1st, 2019 to January 1st, 2020 in the electronic medical health record. Patients were identified from the Academic Internal Medicine Clinic using the criteria of diagnosed hypertension, a BMI greater than 35 kilograms per meter squared, and an age greater than 50 years. Patients with these 3 criteria and a diagnosis of OSA were only included if they had a sleep study report in their chart. Patients with a diagnosis of OSA but no sleep study report in their chart were excluded. Based on these criteria, 2,301 patients were identified and a random sampling of 131 males and 131 females was taken. Of these 262 individuals, 94 completed a sleep study. Of these 94, 92 were positive for OSA on a sleep study, leaving 2 individuals who were negative for OSA. The mean age and BMI for all 262 patients were 63 years old and 41 kilograms per meter squared respectively. The mean age and BMI for OSA positive patients were 63 years old and 42 kilograms per meter squared respectively. In addition, of the patients who were positive for OSA, 61% were found to be male, while 39% were female. Here we have a pie chart that shows the breakdown of OSA severity in the 92 patients that tested positive for OSA. We see here that 12% of the patients had mild OSA with an apnea-hypopnea index, or AHI, of 5 to 15. 38% had moderate OSA with an AHI of 15 to 30, and 50% had severe OSA with an AHI greater than 30. Our abbreviated screening criteria identified a substantial number of patients with OSA. Remarkably, of the 94 patients who had a sleep study, 92, or 97.8%, were found to be positive for OSA, and 88% of those who tested positive had OSA in the moderate to severe range. This abbreviated screening tool shows high specificity for moderate to severe OSA. From our study, Using these three parameters will be useful in a prospective study to determine the sensitivity of this abbreviated screening tool. We plan to perform this prospective study over the next 3 months as our next plan, do, study, act cycle. We will evaluate patients for OSA with an age of 18 to 49 years, BMI 18 to 34.99 kilograms per meter squared, and no diagnosis of hypertension. If we can also demonstrate high sensitivity, we anticipate implementation of this screening tool by January 2022. Thank you again for taking the time to view our presentation.